All right, so we have our last session of the day, I believe, coming up. So please stick around if you can, although I know you are in the mood for some cocktails, so that'll happen soon. Next up, we have a great session on how AI and digital can drive whole health and safety. According to a recent Pew Research survey, 60% of US adults say they would feel uncomfortable if their healthcare provider relied on AI to do things like diagnose disease and recommend treatments. 57% of them say the use of AI would make their relationship with their provider worse. But what they may not be aware of is that AI is already a part of medicine, science, and health. It's just not in our daily lives quite yet. So there's still work to be done when it comes to public trust, and that's a worthy cause because AI can accelerate better outcomes for patients, providers, and other stakeholders. Fortunately, we have two experts with us today to drill down on the ways to build innovative, trustworthy, and equitable systems that utilize AI. So welcome Gail Boudreaux, President and CEO of Elevance Health, and Stephen Gillett, CEO of Verily, and they will be in conversation with Fortune's Maria Aspan. Thanks, everybody.
Thank you for joining us. I think we should start definitions. What AI is such a big buzzword right now. What does it mean practically for each of your companies, and how are you specifically using it?
For us, AI is the latest thing that is kind of captivating the world in what the art of the possible is for adopting technology and adopting capabilities for your businesses. And so we're looking, like most companies, around how AI, both for capabilities we can build, but also for capabilities we can bring to the market across our businesses, and making sure that we're in the forefront of thinking about how they can be applied, how can they be respected, and how can they really make a difference. And I think everyone's doing that right now, or should be.
Yeah, I think our definition is pretty similar. I mean, we think about it and how do we solve business problems simply. And I guess as we think about what we need to do in healthcare, AI is changing every business model there is, and so is integration of data. And so it's kind of three core things. How do we simplify the healthcare journey for consumers? How do we personalize it? And how do we integrate it? And so as we work on these type of models, it goes from the consumer to the healthcare provider to administrative functions, which quite frankly are some of the easier to use. And then how do we work with that across the continuum of things? So our definitions, but I think it gives us an incredible opportunity to use this massive amount of data we have and actually provide better outcomes for the people that we're serving.
You have more than 48 million people covered by Elevance health plans. How do you engender patient trust about your use of their data and your use of AI?
Yeah, I think trust is incredibly important. So, I mean, you hit on it. I think there's a few things. One, we have a model of responsible AI. So before we do anything, we have a group across our enterprise that we've set up principles. We use a single data source. So we have one source of truth. We generally de-identify the data when we share it. And then as I think about the different constituents we use it for, we ensure that the individuals give consent for use of their data, particularly around administrative or other functions. So I think the power of and the opportunity is, again, you hit it, trust. We've got to make sure that we build trust with the people that we serve, both consumers, care providers, and others. And so as I think about the opportunities, some of the administrative functions are a really easy way to start doing that. And we found, for example, in consumers, it's really hard to navigate healthcare. All of us who've been through the system, it's incredibly difficult to figure out both the administrative, but also the clinical, integrate them. And so simply using AI and chat, which is a pretty straightforward, simple function, integrating that with some of our digital tools and our front door Sydney has been a great way for consumers to engage. We've seen it as our highest engagement tool and quite frankly, our highest NPS, over 90%. People come back, they use it, they get good navigation. And that's a pretty simple, I would say low risk type thing for consumers to get used to it and understand it. And we found incredible adoption with it. So that's just one example.
Stephen, I want to ask you about another aspect of trust, which is privacy and data security. I mean, we've seen just tens of millions, I think, according to one estimate, 52 million patients had their healthcare data exposed in 2022. How do you think about, as a tech company, how do you think about engendering consumer trust and preventing such breaches?
Yeah, I joined Verily 3 years ago. I took over as CEO in January. And one of the things I found that was quite interesting was I had spent most of my adult career over the last decade in cybersecurity and in privacy. And as I came to the healthcare industry more broadly, I realized several things were true that you don't necessarily understand when you're on the outside. For example, as Gail and you were talking about, is the data exists in different precincts across your industry. And we talk about our mission, which is bringing the promise of precision health to everyone every day. What I realize is, almost an analogy, the power plants are up on the data, but the power lines are down. There's nothing really connecting all the different kinds of information and data that could make precision health and precision medicine a real thing for you. And having come in it from the outside world, privacy and security, there's no room for error there. This isn't something that you kind of do, or you should do, or maybe you think about doing. If you don't have privacy and security at the core of whatever your data strategy is, then I think you're really exposing yourself and your patients for the 52 million to become 500 million. And I think that's a scary proposition. I think AI itself, AI is great at recognizing patterns, at digesting large volumes of data, and really used as a tool to help your provider, your clinician, your company. You're always, if you're Sherlock Holmes, you always need a kind of Dr. Watson. And I look at AI not in the next Y2K end of the world level, which I read a lot about, or Skynet. I also don't think it's something that can be ignored. I think, as we saw earlier with the heart arrhythmia test and the demonstration, it should really be a great assistant for whatever care you're getting. It should also help you build those power lines and understand where the patterns are of things that can help you get better patient outcomes.
And I would add too, I think something you said is really important. The quality of data is so important in the models that you build. And I think part of our issue in healthcare is just the quality of the data that goes into a lot of these applications needs to continually be assessed and cleansed. And we need to continue to make sure that we're looking at, the basic sources of it, and then how do we continue to refresh it and make sure that it's correct. So I think that's a huge opportunity as we think about the interconnectedness of healthcare.
I want to go to questions in a minute, so if you have one, please raise your hand. But Gail, I want to follow up on that as well, because we heard a couple of panels ago about the ongoing problem of just implicit bias in AI, and your AI is only as good as the data and the programmers who work on it. So how do you think about safeguarding against that?
Yeah, no, I think implicit bias is a really big issue, and quite frankly, it's there. It exists because these models are learning from data in people today. So it's something, again, I'll go back to sort of the framework. So how we design it, test it, then implement it. And we have a group both of inside and outside individuals who look at that because we know how important it is. And so we continually look at these models. We continually refresh our data. And we're looking at, quite frankly, you mentioned it's sort of systematic issues that occur, that we know occur in healthcare. So during the pandemic, we were looking at areas of underserved populations and what we're seeing from those populations. We have a huge focus around social drivers of healthcare and how do you embed that into your data and information. Today, it's not really embedded in most healthcare data. It's not it's a component that we're adding. We're adding it in, for example, in the clinical medical records. We're working with other parties so that we can use that ubiquitously, that physicians can use it as well. And I think that's a really important part of it. But again, I think it gets down to your principles, your culture, your values, and that you have the right model. And again, we set up a responsible AI model from day one, and that was something our board insisted on. And so we're constantly looking at that and refreshing it. I would say there is still bias in that data. We know that because it's based on human beings. And AI by itself doesn't reason. It doesn't have human models. And I think that's an opportunity for us to continue to test that data and make sure that we have our humans, our clinicians, our physicians, and others looking at that to make sure that it's giving us the right outputs.
I'm curious, you both have been in healthcare and in tech for a long time. And Gail, your chief AI officer recently said, every decade there's a new breakthrough technology. I'm curious what you've learned from integrating previous breakthrough technologies and how you're applying those learnings to this newest.
Yeah, I think it's a great question. I think, look, as we think about the potential, it's get it right. I mean, that sounds so simple, but it's make sure we understand it. So understand the models. Well, we're all excited about large language learning and deep knowledge. We don't know everything that it does, and I think that's going to be really important. So again, I'll go back to sort of there's administrative functions. We have massive amounts of data in healthcare, and I heard one of the panelists talk about faxes still come into the ER. We still get records that are paper-based. It's incredible. I mean, these are all easily digitized, right? But we're still getting that. So you think about the opportunity to take massive amounts of data and simplify it, both for us in our clinical. We have something called Digital Nurse Assistant, where we can take all of this paper and basically take 20 to 30% of the work out of what you'd have to input and look and do all those kinds of things so you can get to clinical functions. Same thing with care providers who spend too much time inputting data and again need to get to using knowledge base. So I think that's a great opportunity for us in the short run, and those are the breakthroughs. I think making those breakthroughs on the administrative side, which show efficiency, allow us to have better, I think, better focus on our clinical resources, that's a lot easier to do. But also we can use this data, and I'll give you another quick example. You know, we've invested in 4,000, we call them whole health indicators, where we can tell physicians based on our models who's likely to have their chronic disease progress, who might be most likely to have a fall in their home, or who's going to have an adverse prescription reaction to some of the drugs that they're on. So I think those are models, but they're not alone. They have to be used with clinicians proactively, especially in healthcare, and that's how we're seeing sort of this next breakthrough. And again, it's building trust.
Stephen, I'm curious for your perspective, not only as a tech veteran, but also as somebody who has worked in more retail and consumer businesses before joining Verily.
Yeah, the other thing, having come from big tech and big retail, is a lot of the challenges in understanding human behavior, big retail and big tech have advanced and in many cases solved, that I'm learning big healthcare is still trying to solve. I'm reminded of a story, Dr. Robert Califf, who's the current FDA commissioner, worked at Verily prior to his role, and we were talking in one of our meetings in South San Francisco, and he pulled me aside and he said, I hope it's okay I'm telling this, Dr. Califf, if you're watching. And he said, hey, you were at Starbucks and you spent a bunch of time on their loyalty program and Wi-Fi. Like, explain to me this reward system. How do you get people to come into your store, check the app, remote order, pay? And we started talking, and you realize that a lot of the mechanics that get people to come into your retail environment are very relevant for driving human behavior in other ways. And he was pushing me to say, could you use the same game mechanics, recognition, achievement, reward structures to get people to take their type 2 diabetes medicine, to check in with their PCP, to do a telehealth visit? Can you use the same mechanics and distill them down and apply them to healthcare? And I'd never thought those years in Seattle for a retail coffee company would ever have an application towards healthcare and towards human behavior. But what you find is whether it's a big retailer or it's a family, or it's in healthcare, it's people and it's behaviors and it's incentives and motivation and knowledge. And the more you can understand that, the more I think healthcare can learn from some of these adjacent industries that have spent a lot of time to understand how to motivate and incentivize and reward and recognize people for changing those behaviors. And I think that would be a very interesting thought experiment for this.
I'd love to open it up to questions if we have any in the room. There's a mic coming to you. If you would stand up and tell us your name and identification.
Hi, yes, Zach Williams.
And
do you want me
company
to-
or affiliation.
co-founder and CEO of PIM. Prepare your mind. Sorry? Oh. So one of the challenges I've seen is kind of the advancement of actuarial models, and I'm wondering, in your experience, what do you feel are the biggest impediments to augmenting, refining, I don't want to say commercializing, but ultimately implementing those actuarial models to get, things like value-based care and or, AI enablement integrated in the way that I believe it should be, but you might, I don't know.
Yeah, so I think the broad question is how do we use AI in actuarial models, and we use it today. And I think part of it again gets back to this core is the data correct? Same thing with value-based care. Do we have the right data set? And we're cleaning up data. I mean, simple things like provider rosters, really interesting, simple process in healthcare management, right? And I think getting the right data on that, which we're using AI right now to make sure we standardize all provider rosters and input, and then how we attribute value in value-based care. So that's not as simple a process as since it sounds like you're in the space. So I think that we're beginning to use it, but we still need human intervention to make sure that we're applying the models appropriately and that it's giving us the right input. So I think it's going to continue to evolve over the next couple of years as we get smarter about how to use that and, quite frankly, clean up our data. That's probably one of the biggest issues across the industry, and standardize the data. And I think AI models have a great opportunity to help us do that. We're already seeing some pretty significant improvements in that area. And you can use it in also risk adjustment is another area where we use AI. I mentioned whole health prediction models. We use that now. You can use that to help you understand where to close gaps in care, and I think share that with care providers who are in value-based models. So it all exists out there, but again, it's getting it at scale and cleaning up that data to make sure the models are right.
Yeah, the only thing I would add to that is Verily operates in 3 areas: our clinical research business, our care business, and our health financing, our insurance business. And it's interesting to live inside of an alphabet company of which our origins is from Google X, the moonshot factory, where we have autonomous driving cars, drone delivery, cybersecurity, and of course health tech. And our insurance teams, led by a very, very capable team of decades-long expertise in insurance, paired up with a whole bunch of very good computer scientists with some of the best AI and ML capabilities in the world, and have that team show the computer scientists the models they use to do these actuaries, to do the predictive, to do which businesses and brokers we should partner with. And some of those models have been around for many, many decades, and the statistical relevance of some of them can be enhanced by pairing them up with some of the great computer scientists. And so we have a whole team that works with our insurance and a business to really blend those two worlds at the convergence of healthcare and technology. And I've seen some very fascinating discoveries as you really bring those two kind of traditional, not bedfellows, together in a way that really can enhance and update the way we think about health financing.
Stephen, actually, I want to follow up a little bit on this because, as you mentioned, you are a relatively new CEO at Verily. You came in January. You had to do some layoffs. And Verily has kind of gone through different focuses. There were contact lenses that could detect your blood sugar, I think, at one point, and you pivoted away from devices. Can you tell us a little bit more about coming in and deciding what you were and weren't going to focus on?
Yeah, one thing I talk about is I always use analogies with kids. So my wife and I, we have 8 children, so I always think in terms of kids. Verily is turning 8, and I think in August is our official. So so I think, okay, in the minivan, we used to be in the full booster seat in the very back. Now we're in the middle in just the light booster, and eventually we'll get to the front seat. And that 7.5-year lifespan of the company is the first few years, which are very entrepreneurial. Let's work on new technology, new sensors. Let's assemble some of the world's best physicians, scientists, engineers, and work on great things. And chapter 1 of our company's history had great successes. It also had some more experimental things that didn't make it out. But for the most part, that entrepreneurial spirit was phase 1. Phase 2, which was the 3 years, roughly 3 years of COVID, from 2019 until 2022, when the company shifted towards, like all companies and many companies in healthcare did, towards response to the pandemic. And I think Verily did a very noble job to really galvanize the capabilities of the company to do that. And now in the last year or so, we're in phase 3. Phase 3 is going back to the basic building blocks of the company. How do you create enduring products that solve unmet, underserved needs in the marketplace, that have strong business plans, and find the right balance between execution of the delivery of those plans while still maintaining some of the first generation attributes of the company, which is still be entrepreneurial, experiment. And if you go to our website or you check us out, we do everything from mosquito abatement to mental health, and from clinical research to health financing. And there's a whole bunch of things in between. But everything that is there as of January has a strategy, has an operating model, has a leader, has a business plan, and has a budget, and they execute against that in a way that will be the third chapter of the company.
Well, hopefully when your company's a teenager, he can come
Yeah.
back and tell us about it. Thank you both so much for
Thank you. Thanks. Great to be here.
All right.